So we're going to do our best to share some resources with you today. I want to share my screen just real quick. One, I want to point you to our website we've launched and our web landing page called Business as Unusual. These are definitely trying times, and we're doing things different than we've ever done it. We know we've got to push through together. So we're working to curate resources here for business owners to some upcoming events. This is our first one, dealing with a healthy workforce, those of you that are essential employers and still have employees, you still have customers, your grocery stores, your healthcare, your public facing, essential businesses. We're going to talk about that today, how to deal with this during this time. Also sharing stories about entrepreneurs and businesses that are being creative in this time and finding ways to push through. If you've got a story of a business or you are a business, we'd love to hear from you around that. We've also got our business innovation champions, a team of really Ryan Jones is our director of that program, and then 5 team members where you can reach out to them by phone or email. They are, here to support you during this time. If you're working to deploy some type of new technology or e-commerce or functionality, they can help walk through that with you. They're also a great referral resource to many of our resource partners. We work all the time with the Small Business Development Center, with MACID, with SCED, with Kentucky Highlands. EKSEP is a great workforce partner. We're part of this Kentucky Innovation Network across the state. So you can find on this Business as Unusual website links to all our champions, connections to resources. We want to be helpful there for you. We've also got a small business impact survey. I think we've had about 124 responses so far. I've not checked the most recent ones, but into 118, up through 118 responses, we only had 7 maybes that these businesses would close permanently. We had 0 yes, we plan on closing permanently. And so that was encouraging news for us. To know, I'm a small business owner myself. I've got a guitar store, and we've had to close our doors. We do a decent amount of business online, but it's not all of our business, so it's affected us. Our entire SOAR team is working remotely at the time. We're no non-essential travel. We canceled many of our in-person events, and we've really just transitioned to this. And this is amazing technology that allows us to address pressing issues and spread communication. Margo Riggs, Dr. Riggs, has been on the SOAR team for several months now, and she is our CDC liaison. We've been blessed with that in Eastern Kentucky to have her boots on the ground, assisting with local healthcare providers, our health departments, being a conduit of communication between them and the Kentucky Department of Public Health, and also the CDC in Atlanta. So she has been, we've done everything the last couple of weeks, from hosting workshops, an online Zoom call with Kentucky Department of Public Health and local clinicians to help them understand how to test, who to test, and on the health care side, we've also been helping coordinate and organize PPE donations, cloth masks, all those pieces of this solution. We have moved from long-term big picture things to very much a sense of urgency about this issue we're facing now. We know how serious it is. We think we're taking good steps as long as everybody keeps staying at home, and as much as possible at social distancing, we can minimize the effects of this. And our team, and like many of you, are already planning to come back out of this. How do we economically come back out of this? So I want you to know people are thinking about it and working on it. So for today's session, I'm going to turn it over to Dr. Riggs in just a moment, but just a few technical items that I want you to make sure you're aware of. If you've got a question, there's a Q&A feature down at the bottom. As we go through this, please feel free to submit a question there. I'll be watching those, and Margo will be watching those. We'll do our best to answer those. She's going to go through about a short overview of the resources that are out there, some basic recommendations. Also, Feel free to use the chat feature if you got a resource you'd like to share with the group. The beauty of this is that we have some resources at SOAR and at CDC, but you all are out there, boots on the ground, learning this, doing, implementing things. So feel free to share resources in the chat. Again, feel free to use Q&A if you've got questions. We'll do our best to answer those. Once we get her overview and do our best to answer the questions you've submitted, what we will do is there's a feature where you can raise your hand. Everybody who submitted, you're automatically muted. This is a webinar, not a full meeting. But if you have a resource, something you'd like to say and share with the group once we're through our overview, just use that hand raise feature. I'll be watching for that. When you raise your hand, I will unmute you and allow you to share a few words, and we'll do our best to get as much of that as we can in. But for the questions part, it's much easier if you type them in advance as we go through this. And if you got a burning question right now you'd like to have addressed, go ahead, submit it in the Q&A at the bottom. I'll say we're also streaming live on YouTube. We were going to stream live on Facebook. Apparently that feature is broke this morning. We've tested it before, so we're streaming live on YouTube. We're also going to record this, and that will have this resource out there for the ongoing future. We'll curate it. All the resources Margo shares will get on our website and an email to all attendees. So it will be there for the long haul. So we're going to move right on. I'm going to turn it over to Margo and let her get started. And if you have questions, submit them at the bottom, and we'll do our best to answer those.
Okay, thank you, Jared. Good morning, everyone. As Jared mentioned, I'm Margo Riggs. I'm with the CDC, the Centers for Disease Control, and I'm assigned to SOAR, overseeing the healthy communities efforts within SOAR. But with the pandemic coming upon us, I sort of switched gears, and I'm serving as a resource to the region and helping out with our preparedness and response activities. So I'm grateful for you joining us. I'm grateful for this opportunity to share information with you about preparedness and response in the workplace during the pandemic. And I'll do this overview, and then we'll open it up for some questions. So I'll switch over to sharing my screen. So I'll start out with some basic information just about what's going on in the US. This is the most recent map that's on the CDC website, showing how the cases continue to increase, as we're well aware. Kentucky, we're doing a little bit better than some of our fellow Americans. For instance, in New York, Michigan is getting hit hard, and of course, we've known California and Washington from the beginning. So some areas are getting hit pretty hard right now, and predictions are we're not quite at the peak yet, so this is going to go on for a little bit more. And as we know, the president recommended our continuing of all of the guidance and plans for protecting ourselves from spreading this virus around through at least the end of April. And in some areas, it may extend a little bit beyond that. And now I'll switch over to the map that shows us Kentucky. We're all familiar with this. We see it on Governor Beshear's nightly chat with us and kind of updating us on how the cases are being identified around the state. But please note that although we see a lot of counties that remain white, which would indicate 0, as the governor and Dr. Stack, the commissioner, said, this virus is in all of our counties. What this map shows is where those who are the most ill have been identified, because remember, the testing is not for everyone. Everyone is not going to get tested, and they don't need to be tested. But we do know that the most ill, those who are prioritized for testing, this is where we've identified them. And it's more important to know at this point about those who are most seriously ill and about the deaths that occur, because that really gives us a sense of how hard a state or a region is being hit. But because we may be having a little less impact than some other states, doesn't mean that we shouldn't do our part. We need to do our part to follow the federal state and local guidance to social distance and to practice those standard hygiene precautions that we've heard so much about regarding hand washing and not touching our face. And so what does this mean for the workplace? Each business type and location may have slightly different scenarios that you're facing. And I hope that the information that I'll share from our state and federal partners can help you adapt those basic guidances to keep sound infection prevention principles in mind as you protect your workers and your customers. So let's talk a little bit about social distancing. What does that mean? We've heard that term a lot. We've heard stay 6 feet apart. That's really the basis of what it means. We need to stay 6 feet apart from others, and that means anyone who you don't live with. We're seeing a lot of people gather out to do social activities or even in the workplace, and they're familiar, they're friends, and they're hanging out together, but you have to keep in mind that when you are with any group close like that, you are now risking exposure and taking things home to your family. And likewise, whatever that family or others, that individual might have been exposed to by being around groups is now bringing into your workplace and exposing coworkers and customers. So please keep that in mind about social distancing. It's 6 feet apart from anyone who is not someone you live with. And I'll take us now to the CDC site. So this is cdc.gov/COVID-19, the basic CDC site you've heard about, I'm sure. They have some general information at the top, how to protect yourself, what to do if you're sick. I'm going to move down to the area that deals with businesses and employers. But before I do that, I'll just mention there is a separate area for healthcare and public health. So there are specific guidances for healthcare in particular. There's also a spot, I think I can point this out here, for first responders and law enforcement. But for now, I was going to have us head to the businesses and employers. There's a lot of good guidance. We have information that's the interim guidance developed during this response, as well as detailed guidance for cleaning and disinfection. This is for homes and workplaces. And as we look at the interim guidance, so these are sites that you can visit to get a lot of information. They have updated guidance about cleaning and disinfection, best practices for social distancing, and updated strategies and recommendations to implement. It goes into a bit of the purpose for this document, how to prepare the workplace for a COVID-19 outbreak. So our goals are to reduce transmission among our employees, try to maintain healthy business operations as much as possible, and maintain a healthy work environment. And even for those who have had to shut down, this will be so important as we start to come back on businesses open again, for you to be able to keep things as safe as possible. Because although we may open again, it's not going to be just a start where everything is in social distance mode, and then all of a sudden one day we're going to go back to just everything as it was before. It's going to be a gradual change. So we need to keep these things in mind. They have guidance on reducing transmission for your employees. Obviously, encourage sick employees to stay home. There are things you can do in the workplace to identify individuals based on their risk category, like how much they may be at risk for having an adverse outcome from being exposed to this virus. And there's also ways to protect your workers if you have customers or so, that some people that are coming in who have cough, and ways to do things to help prevent that exposure to your employees. CDC also links to the OSHA guidance. I'm going to talk about that in a little bit. But with regard to any sick employees, they should be separated immediately and sent home. They should not be the people that are out interacting at the front office. You should do your best to try to isolate them and get them home as quickly as possible. And educate your employees. We really need that information coming out from multiple sources and trying to let the employees also understand what they can do to protect themselves and how to protect themselves, particularly if they're at higher risk. And so the importance of learning how to keep everyone safe is to maintain a healthy business operation. Many businesses have had to close, but we do have our essential services necessary for sustaining life. So we really need to do everything possible to keep people healthy in the workplace for these essential businesses that are going to be staying open. So thinking about things you can do at the workplace, having someone who's a coordinator, having a plan in place for emergency response activities such as what we're in right now, having sick leave policies in place, allowing people to work from home as much as possible, and really understanding that we're relying not only on you and your business to keep things moving for those who are still open, but also for those who will open as things start to relax a bit with our restrictions on social distancing by closing everything down. We want to have the opportunity for you to be a part of our community, right? Helping to get this message out with all of those you interact with, be it the customers or other businesses that you're interacting with. So talk with companies that provide business or who may contract with you. Make sure you're understanding how things work with all the businesses that you may interact with, particularly supply chains, understanding how they're taking efforts to be safe as well. So I'm not going to go through everything in this document, but what I think I'll do after sort of giving this overview of the CDC site is move over to the OSHA site. Of course, as we do things to keep our workplaces and communities protected, need to stay in accordance with OSHA guidelines. They have specific guidance, of course, for healthcare, laboratories, solid waste and management, all of those. They have specific guidance that can be reviewed in detail for all of those areas. But I'll open up the document that they created specifically for COVID. I was down a few pages when I last looked at it, but here's what it looks like: guidance on preparing workplaces for COVID-19. And I'll move down to the section that talks about some of the specific things that I've had questions about and thought it would be good to cover today. So I've talked about social distancing. Of course, that's our number one thing that we need to do to keep people safe. But there are other things to do in the workplace regarding engineering controls, right? That's our first step for workplace safety, is having engineering controls in place. And this might involve things like installing high efficiency air filters, increasing ventilation rates in the workplace. And a lot of companies have started installing physical barriers such as clear plastic sneeze guards. They're using those plexiglass sneeze guards. So there are many things you can do to provide physical barriers. I've seen even some businesses that didn't already have a drive-through have installed a drive-through or are working out a safe way to do curbside service. And so those are those physical things, physical barriers that we can put in place. And so we have those actual physical barriers, but there's also some other types of physical barriers that can be done, such as marking out areas on the floor with tape to indicate where a 6-foot distance is, restricting the number of customers that are allowed in at a time and having folks wait out in their car. I had to take my dog to the vet, and veterinary care is considered an essential service to provide for the health of our pets. And that's exactly what they're doing. The veterinarian comes out, talks to you through the car window on the opposite side, and then they get your pet and take them into the building, and you wait out in your car. And other businesses could be doing that as well if you interact with a client one at a time and have that opportunity to have people line up in cars or wait out in the parking lot and communicate via phone with your customers once they've arrived. Those are some of those things we can do that are actual physical barriers, as well as, you know, sort of a virtual barrier, if you will, of taping out markations on the floor, or blocking certain aisles and having like a one-way in, one-way out, or one-way up and down aisles. Those are physical things we can do. But there's also administrative controls that can be done. Having the sick workers stay home, as I already mentioned, minimizing contact among your workers and clients, replacing those face-to-face meetings, really trying to keep that 6-foot distance as much as possible between workers in the workplace. Also doing things like decreasing the number of employees at work at a given time. I think many have done this, sort of going to shift work so that you don't have all of your workers there at the same time, but maybe they come in different shifts or having extra shifts or alternating days. There's also the ability to do cohorting, where you have workers who normally work on a shift together, they stay together or doing a similar task, might stay in the same area so that they're not interacting with everyone around the business. You try to keep those same shifts working together so they're only exposing the same people throughout this process. But you also need to think about having some depth in your workplace coverage. So you don't want all the people doing the same thing working together and risk, that entire cohort of individuals to become infected, and then you're not able to continue with that maybe essential service in your business. So you have to sort of stagger who works. And another important thing too, tracking travel of your employees. So understanding where they have been, either when they're off work or when they're doing things on duty. The governor just put out that the decree that we are not to leave the state unless it's for certain reasons. Working is one of them, but tracking where your employees have been and understanding that if they've been out on leave or away to tend to a family member, taking extra precautions that they might have been exposed depending upon where they have recently been, and thinking about those of your employees who are at the highest risk. How could you reduce their exposures as much as possible? Those may be the folks to prioritize to telework or have a role within the business where they're not interacting with customers as much. You want to reduce the risk as much as possible for those in that high risk group who are over 65 or have the chronic health conditions that we've heard so much about, which includes heart disease, lung disease, including asthma, also diabetes. And we know here in Appalachia, in particular, in Kentucky in general, we have a lot of our population that falls into that category of having chronic disease. So we really need to do the best we can to protect. And then also mentioning with the administrative controls, things you have under your purview as an employee, training your workers to use appropriate PPE, personal protective equipment, how to use it, when to use it, and why to use it. Of course, when we use PPE, it's based on the hazard that an employee is likely to be exposed to. A lot of that doesn't change just because COVID is here. I've heard many requests of workers wanting to wear gloves. If they don't normally wear gloves, it might not be the best thing to have them start wearing gloves, because the best way to keep your hands protected is to wash them. People think that, oh, if I put a glove on, my hand will be protected. But the problem is that same contamination, germs, and the virus can get on the gloves. And so then the gloves would need to be washed just as frequently. So it might protect that person's hand, but whatever's contaminating the glove is still on the glove, and the person may rub their face. And I know I've seen folks do that all the time in food service or other areas where they normally wear gloves. They wear the gloves and move around that business and never change the gloves and never wash the gloves. So they're just contaminating what all around the business. And masks, many are asking for masks. The CDC is recommending that people who are well do not need to wear masks. When masks can come into play, and where CDC has looked into sort of changing that guidance, is for those who are ill. So as we start to have businesses come back up online and workers return already been exposed, that's a time when we might need to think about wearing masks. They aren't necessarily going to be the N95s or the surgical masks, which are in such great demand and needed for our healthcare providers, but that's where the cloth masks can come in, homemade masks. Again, it's not to protect that individual or the general public from getting exposed. It's to contain that person's cough and sneeze and, any chance they may have of spraying and spreading germs around. So it's meant to be a way to protect all of those around a person who may be coughing and sneezing. So that's where we might see a change in that, where masks are coming into play to be used as people return back to work. And there are also guidance in place, and it's mainly for healthcare, the use and reuse of personal protective equipment. So in the US, our normal standards of care do not involve reusing PPE, masks in particular, N95s. But because of this high demand on the need for PPE, there are steps in place that CDC outlines with regard to reuse practices. So a couple other things I wanted to mention. Think about when your workers are going home. This is something that you can remind them about as well, depending on how much interaction they're having with other coworkers, as well as with the public, your customers. They need to think about cleaning before they get home and interact with their family. So this may involve, having to remove their outer clothing when they get home and put it straight into the wash, showering, doing everything they can when they arrive home to reduce the risk that they may expose their family members and loved ones by trying to clean themselves as much as possible, and definitely washing hands once they get home before they start interacting with family. And then I'll show one last resource. This is from Harvard, and it's for their health services. I've had a lot of people ask me, do I need to self-isolate or quarantine based on maybe 1 or 2 people removed from a person that's a known positive or that is being tested because they're awaiting results and they themselves were exposed. So this is guidance. They qualify for people with no fever or respiratory symptoms and who are not healthcare workers. Healthcare workers and those who have symptoms are given specific guidance by their healthcare providers. But this is just something, it's in line with CDC guidance, but I think they did a really nice job of outlining this algorithm of what to do. So it walks you through, on the left, a person who has tested positive for COVID-19, they have a close contact A, and then B is a close contact of A, and C is a close contact of B. And it walks you through those steps. So if you are person A, you would quarantine yourself for 14 days. This is the standard guidance. So A was exposed to a known positive. And then it tells you if you're person B, which this is happening a lot, right? We have a coworker, maybe person A, exposed to a family member who's positive. Well, now I'm a coworker, I'm B, what do I do? And, again, this is just a general guidance. Use this as you see fit to help guide you as you make practices. This is not a set guidance. I just wanted to share with you a resource that I thought explained things pretty well. And it also goes into someone who has symptoms and is awaiting, and then a person who's well but traveled. So it's a helpful resource, I think, that you might be able to turn to. Okay, and with that, I think I will end my portion of the summary and trying to hit some of the main questions that I've been asked, and open this up for questions. And I see one question. The CDC has backed up on the mask. So I was just talking about that. Again, the mask is to be used for those who are ill or who might be ill, and it's to cover your face so that you don't expose others. They also said the reason they told the public masks didn't help was afraid they'd run out. So that's part of it, right? We didn't want to use masks for those who were not needing those masks and risk running out because people were using them needlessly. And the Surgeon General even came on saying, stop buying masks. So again, the guidance hasn't changed as far as a mask protecting you. The general public and all of us walking around do not need to wear a mask to protect us from something in the air. This virus is not airborne as far as we know. It's in droplets. That's what the 6-foot distance is about. the droplets are heavier, they fall down within that 6-foot radius around us if we cough or sneeze. And so it's not generally floating all around in the air. And that's why a mask is not something the general public should be wearing to protect themselves. But if you're in having just recovered recently, or you're at risk of having been exposed and you are coughing, sneezing, or at risk of spraying onto someone else, that's when the mask comes into play. And I think that was the questions I saw up on the board. Are there any other?
Any other questions that you all would like to submit? Please submit those in a written down at the Q&A box there. We had a couple come through the chat that we got answered. One person was, they are a repair shop on 18-wheelers and build parts for 18-wheelers. We shared that we're pretty confident automotive repair, where companies were listed, they would remain open as essential. And I think Tal got that list of employees and submitted it there. So if you want to see that link from the governor's office, what categories were considered essential businesses, you can find that in the chat box. Looks like we've got another question. I'll let Margo answer that.
Sure. Someone was asking about if the virus can stay in the air as an aerosol for 3 hours. So the information about that came from a controlled research setting. That was when it was a closed environment and under, these perfect conditions of no airflow and that sort of thing. And those who might be in a situation like that, the closest that would be similar to that research condition would be healthcare workers, or those who are in a confined space in the hospital or clinic environment, and they're doing procedures where the virus becomes aerosolized by what they're doing, either sticking swabs into the mouth to get to the back of the mouth to take a sample, or through the nose to take a sample. So, or other things that are causing spray. That's why we want our healthcare workers to be protected. In general, others are not going to be doing things like that who aren't in the healthcare field. So again, that 3 hours was in that very controlled research setting, and it's not known to be true when you're out where there's normal airflow and wider open spaces. There are certain, recommendations we have for those who might be in more confined spaces. One of those situations that's come up and I've had asked of me was regarding workers in a vehicle who have to be in close proximity. They can't be more than 6 feet apart if they're in the cab of a vehicle. And for safety reasons, in general, for instance, utility workers or sanitation workers driving garbage trucks, what can they do? And I pushed that question up to the Emergency Operations Center at CDC and the National Institutes for Occupational Safety and Health. And the guidance there is doing the best you can to maintain those separations as much as possible. For instance, have dedicated doors that the driver is only going in and out on the driver's side, the passenger only in and out on the passenger side, keeping hand sanitizer available in the vehicle, keeping disinfecting wipes available so they're wiping down those common touch surfaces, keeping the windows down in those vehicles as they drive to help with airflow, and also doing temperature checks. That's something you can do if you have workers who are going to be in close proximity. Mandatory temperature checks before they start their shift, at the end of the day, twice a day, checking temperatures so that you can detect any slight increase that might indicate they're starting to have symptoms by having a fever. And of course, anyone who has active symptoms such as coughing, sneezing, or any of the other respiratory symptoms, to not allow them to be in the vehicle if at all possible. And then it says, are the restrictions for opening daycare centers different from retail units? I'm not sure if that means once we're able to start opening again. That one you would have to follow the guidance from the state. And follow, I forgot the agency that deals with the oversight of daycare centers, but they would have specific guidance regarding that. CDC also has some general guidance for daycare centers, but you would have to follow their guidance specifically. And where can I find the contact graph you displayed? The one that the Harvard graph, we're going to send you the link for that after this webinar. But you can find it on the, it's HSUH, I think, or don't, let me not say it. I'm not looking at it right in front of me, so I don't want to give you the wrong thing, but we'll definitely share that link with you. And I can post it up here if I pull it up on the internet quickly. Someone is a manager at a grocery store, or a manager. Yeah, having everyone wear masks and gloves, especially when the first month is coming up. We have shields up on the register. So you are saying that we really don't need to wear masks when we know that the store is going to be real busy. He is really worried about this. So what I would recommend, because of the challenge of number one, having enough masks and gloves, and number two, making sure that if you're wearing gloves, you still have to wash your hands, having that distance in place is your first best measure. Limiting the number of customers in at a time, marking out those 6-foot marks for checkout for the cashier lane. That would be really the best procedure. Certainly having the shields at each register really gives you that physical barrier, so that if you have that in between the worker and the customer, wearing the mask just really wouldn't be necessary because there's no spray coming in, as long as the barrier is going above where their head is. And one of the challenges with the masks, if you're well and you're touching things, whether you have gloves on or not, your face gets itchy having that mask on. And so your tendency is to touch your face more and lift the mask, pull it down when you want to talk. And so then you risk having more exposure likely because of that.
I don't see any more specific questions right now that are typed out. Oh, we've got one more.
So this is about doing HVAC services in people's homes. What steps do you recommend when going into people's homes? Yeah, so again, keeping that distance always is number one. This is an essential service if someone needs to have repairs that are essential for them in their home. So definitely using the normal protective equipment that you would in that type of workplace situation. Gloves, that's fine if you're going to be touching common use surfaces, but the better option, I think, is using hand sanitizers, using soap and water. Soap and water is the #1 way to keep your hands clean. And assuming that you can either use an outside spigot or potentially use the sink inside if that's possible. But also you can do things too where you have water for hand washing available on your truck with the water cooler kind of thing. You can either have hand sanitizer or do those sort of mobile water options to have ability to wash your hands. And really hitting home with your workers that when you're in that home, any surface they touch may be contaminated with the virus. So you have to be careful about not touching things unless you absolutely need to for the piece of equipment you're working on, and then washing your hands or using the hand sanitizer immediately after touching. So this question is about testing. Other countries that have contained the virus had more testing for asymptomatic people who didn't have symptoms, and they could quarantine them to keep them from spreading. Understand that we are behind and don't have the test, but when will we have broader testing available? So that's coming up more and more each day. We are probably not going to get to the stage where we're going to test everybody. Again, that is probably not necessary. But as we get the rapid test, which I think you heard over the weekend, that the White House was saying that test just recently came out, that'll give you an answer in 15 minutes. That will make having knowledge about your status more readily available. But again, that quarantining still relies on that individual to do the right thing. If they think they might be exposed, if they go and get a test, if you are getting a test, you are supposed to be quarantining yourself until you get that result. And once you get the result, then you have mandatory isolation, whether it's at home because your symptoms are able to be managed at home, or you may have to go into hospitalization if your symptoms are severe enough. But one of the things that the countries that did more testing had was compliance from their population, either mandated by governmental lockdowns such as China or even in South Korea. And whether we probably aren't going that way, we don't have those same governmental restrictions where we lock people down and have martial law where they are forced into their homes. You're seeing that challenge with individuals right now when we don't have a big spike in cases where they are being put on mandatory quarantine or isolation and they don't do it. And so that requires legal being brought in to make them do it. And that's challenging if you have a lot of people. So it really is relying on that individual doing what is their civic duty to stay home. And that's why we are asking everyone to stay home right now. And we've taken such drastic measures because anybody at this moment could have been exposed to the virus. And so we should all behave as if we might be at risk of exposing someone else and not just wait to get a result from a test. But we will see more tests coming on board. I think the more important thing, as I mentioned at the beginning, is knowing those who are most ill so that they are hospitalized and then have access to some of the treatments that are being tried for those who are known positive. Some of those treatments are risky for an otherwise healthy person. So we only want those who really need it for life-saving measures to have access to those treatments. And we also need to know our healthcare workers and our first responders. Those are the folks we need to keep healthy and ensure that they are not exposing others because of the nature of their work. And that's why we're asking in any place of employment that is open as an essential business during this time to monitor yourself for symptoms. Do not go to work if you are sick, maintain that distance, and do everything you can as an employer to be aware of who may be exhibiting symptoms and how to keep them away from exposing others.
All right, we don't have any more written questions in. There was one in the chat about why are cabinet shops open. We listed out that we gave the link in the chat box for the governor's executive order that listed the different groups. Any type of building supplies, construction type facilities were included in that. We weren't involved in making those decisions, but for that list, you can go there to the link that's in the chat box. I'd like to, many of you are running stores right now, you're doing things, maybe you just would like to give examples of what you're already doing. If you'd like to share that with us on your name, there's a place where you can select to raise your hand, and I'll be watching for those. Anybody who just like to, if you'd like to verbally ask a question or share what you're doing, share a resource. This is really, again, this is new for all of us. We went over the list of resources as efficiently as we know how. But if you've got something you'd like to share, please just hit that button to raise your hand, and I'll be watching for that. And I will unmute you and allow you to share with us. I don't see.
And I just shared in the chat, I shared the link for that graph, the algorithm from Harvard.
As we're wrapping up here, I'm not seeing anybody raising their hand. I'll give everybody just a couple more minutes. I will say, as an essential employer, I know you're dealing with unemployment things as well. You may have had to lay people off. You may be considering having to do that and wondering, all those impacts. These new regulations and guidelines as it relates to unemployment are obviously making things, there's a lot of new things happening all at once that leaves a lot of questions. So this Thursday, we've got Josh Benton, who's the Deputy Director for the Workforce Cabinet of the state, spending an hour with us going over what these new guidelines mean. As an employer, what does unemployment mean for employees? We've heard everything from employers are saying, hey, people, these new guidelines, we have employees who are scared to come to work, so they're just quitting thinking they can draw unemployment. We've heard things like, is it better for me to cut hours back or just lay somebody off completely? So a lot of those questions that you may be having, we encourage you to go register for this one on Thursday. It's at 11 o'clock as well. SCED will also be having a marketing session that day at 1 o'clock. We've got their information listed on the website for upcoming events. Starting next week, it will be less urgent topics, more about things. All right, we're at least in another month of this. What are the things, if I'm a retailer or, I'm not necessarily an essential business, how can I find creative ways without having a storefront open to continue to grow my business? So we'll be doing things like YouTube videos or, YouTube workshop from a guy who's got 600,000 subscribers and runs his entire business essentially through connections to YouTube. And also the group of retailers up in Moorhead, New Frontier Outfitters. They built an Appalachian apparel brand, and they ship things all over the country, really globe. And they're going to talk about how they do retail in the digital economy. So we encourage you to keep watching back, checking back on this website. We're going to do 1 to 2 a week for the next several weeks. Just try to be a resource for you. If there's something we're missing, if there's something that would be helpful, please let us know, and we'll do our best to capture those resources and deliver it as efficiently as we know how. You'll get an email when this is curated and up on the website. So if you've got other managers, other employees, other people you'd like to send it to, you'll be able to forward it on. Looks like we got somebody with a hand raised. Tal, I think I've turned your mic on. Oh, maybe not.
He might have wanted to mention that he posted in the chat the link for the governor's latest guidance regarding daycare.
That's
So
exactly right, Margo.
All right, anybody else before we go? If you've got a question, just raise your hand or a comment. Let me say thank you. Let's just finish it there with us letting you know how much we appreciate what you are doing, the risk that you're taking to meet the needs of our community. I don't know how many times Governor Beshear said, we're in this together, Kentucky, we're in this together, Appalachia, Kentucky. We have got to do our part. If you don't have to be out, if you have employees that can work remotely, please let them do that. If you have to be out, I think we've heard the core of this conversation is social distancing. We got to do practical things in the workplace to make it easy, make it just happen that people are separated. So whatever you can do to make that happen will be greatly appreciated. We're here as a resource. You know how to get a hold of us. Thank you again. This is a conversation. Not every day at SOAR do we have conversation workshops that will save people's lives. But you taking the right steps and doing the right thing in these situations has the capacity to save lives. So thank you. And again, let us know if you need anything else. Any final words, Margo?
Yeah, just stay safe. washing your hands, keep social distancing, and go to legitimate sources to get your information. Go to the governor, the kycovid19.gov, cdc.gov. Please go to those reliable sources for information, because there's a lot of misinformation flying around out there. I know a lot of our local health departments have been doing a good job in putting things up on Facebook. And so there are legitimate Facebook sites, but there's an awful lot of misinformation out there. So stay safe. Thank you to all of you who have kept the businesses going to keep everybody fed and getting their essential needs met.
Thank you all. Have a good day.